Hello dear viewers and welcome back, and I hope you enjoyed that report about mosques. And now we have an esteemed guest. He is named Dr. Sumant Misra. He is a pediatric dentist at the Ministry of Health. Hello doctor, how are you and how's your evening with us?
Hello, good evening. How are you all?
Good, not bad. So tell us a little bit more about why oral health is so important and how can it impact our life in general.
Mouth forms the portal of entry for the body. Whatever we eat or drink goes through the mouth. So it's like a gateway. As per the recommendation by WHO, World Health Organization, if we neglect oral health, it might leave us with more risk factors for cardiovascular diseases, diabetes, respiratory diseases, or even acute pregnancy disturbances or outcomes. So as per the study done in 2019 by the Global Study of Diseases Burden, 2019, they found out that approximately 3.5 billion population globally is affected by oral health diseases, mostly untreated dental caries, which might lead to a lot of economic load on the country, might run into billions. And many studies have found out if we ignore the gum health, then it might lead to severe condition known as periodontitis, inflammation of the surrounding tissue surrounding the gum, periodontitis, which is a risk factor for cardiovascular heart diseases or even stroke. And one of the studies found out if somebody has periodontitis, they have 49% more risks for getting cardiovascular diseases, heart diseases due to chronic inflammation. Also, American Diabetic Association found out that in cases of gum diseases, the control on diabetic sugar level is lost, so leading to exacerbation of diabetes. Also, oral health is very essential for speech, self-confidence, as well as development of the country. So if we have good oral health, it is overall good for the systemic health as well.
Very true. So you know that basically since we were kids, our parents always tell us to basically take care of our teeth and brush it 3 times a day, especially at night. Now there are common oral problems though. So how can we prevent them from happening from a young age until we grow up?
Yeah, train them young, catch them young. So the habits inculcated in the kids from the early childhood is the best one. So we start early treatment and prevention, as they say, prevention is better than cure. So even WHO, World Health Organization, and American Association of Pediatric Dentistry, American Academy of Pediatric Dentistry, AAPD, they recommend get the child visit the dentist as early as 1 year of age or within 6 months of the eruption of first teeth. Why? Because then the dentist can make the parents aware what kind of fluorides needed in the toothpaste, the brushing techniques, and all the preventive measures, as well as the fluoride applied by the doctors professionally, dentists. All these are very essential to be inculcated in a kid since beginning. So the parents have a very crucial role in this. The parents should start brushing with soft pad in the gums of the kids, as well as the tongue, to remove any food debris or any accumulation of fungal infection, anything. So the sooner the better.
Okay, so when do we actually start letting our kids start to go visit the dentist? When is the right time, and how can we make them be dependent of it once they grow up?
Yeah, so as we recommended by the American Academy of Pediatric Dentistry, the soonest by the age of 1 or within 6 months of the eruption of first tooth. Once they are to the dentist will recommend various brushing techniques and also the parents' job of the parents. And following it up at home, home care is very essential. So the parents should involve at home, like let's say start early cleaning, as we just now said, with the damp gauze, cleaning the gum pads and the tongue. Also making the brushing funny, making it like a fun, and doing, like we talk about brushathan, we are advocating brushathan, like marathon, running together, speakathan, speaking together. In the brushathan, they brush together in the family. So leading by example, because a kid learns from the parents, learns from what he or she sees. So if the parents involve them, they can use 2-minute challenge, as American Dental Association says, or American Academy of Pediatric Dentistry says, brushing 2 minutes twice a day with fluoridated toothpaste and with soft bristles toothbrushes. So if the parents lead by example and periodically reward the patients, the kids, by stickers and their cartoon characters, and also there are timer brushes which they can time for 2 minutes. So it's like a 2-minute challenge, inculcating this habit since beginning, and also brushathan, brushing in a team. So all these things.
You know, they always say like an apple a day keeps the doctor away. So brushing twice a day also keeps the doctor away. But we can't actually keep the doctor away. We have to, you know, go and visit the doctor every 3 to 6 months just to check on our oral health. Now, I see that you brought, you know, some props over here. So what is the best technique, if you can show us, to, you know, to brushing the teeth?
Yeah, so here I have got this model, the prop, as you rightly said. Brushing is basically for the kid. Like I deal in Ministry of Health, kids less than 6 years of age. In adult, we talk about various techniques, most followed like modified Bass technique. But in kids, they don't know about the various angles. So normally we say, mochidi, not like this, in and out, up and down, round, round, circle, 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 circle. So basically it's not in and out, it's like a circle and covering all the surfaces. Like we teach them to start from the upper right corner and then the front and then the upper left corner, and also opening and the last tooth inside, also inside surfaces, on the chewing surfaces as well. So that chewing surfaces, all the grooves and pits and all the grooves are cleaned by the teeth, by the brushes, and not to forget the tongue. So cleaning the tongue is very essential as well. This basic.
So this is the best practice basically to keep the oral hygiene at the best.
Yeah. So in brushing, we have to tell them about the brushing, but according to studies, 40% of the surfaces of the teeth are not reached by these brushes alone, because they are interdental between the teeth. So for that we have we can use flosses, or we have small like brushes, interdental brushes with different sizes. So these can go interdental in between the teeth to clean any food debris stuck between the teeth and where the normal tooth brushes doesn't reach. So all these things. This is quite essential, and so this is adjunct to toothbrush. Toothbrushes, flosses, interdental toothbrushes, interdental brushes, and mouthwashes in case of bigger child so that they don't swallow.
All right. Thank you so much, doctor, and I hope for you to have a pleasant evening today. You really gave us a lot of great informations, and I hope that everyone actually did take away some great advices to start with, you know, with their kids at the young age, to how to, you know, teach them and practice them how to actually brush their teeth in the right and correct way, and also to visit the doctor now and then. Thank you so much for your time. All right,
thank you very much.
Yeah. All right, dear viewers, thank you so much for your watching with us today with our esteemed doctor. Now we have the report about heritage, and we'll be right back right after this.